I'm Rhodel Dacanay. I'm actually a private practice as well as an academic anesthesiologist. And I have formed a company that is here to advance patient safety in the vascular catheter space. The company is Nevent, and we aim to make retained guide wires in our patients a thing of the past. Retained guide wires actually are the result of a medical error that occurs when you're placing a central catheter or an arterial catheter via Seldinger technique. Remarkably, it happens about 1,540 times a year with a 5.5% mortality rate and about a 10% serious morbidity rate. So the cost of the patients is large and it's real. The Harvard Foundation found that it's costing hospital systems and physicians about $830 million every year of additional cost of doing business. And so it's really costly for all stakeholders. And at Nevent, we have a patented solution. The patent was issued last November, and Nevent was formed to get this device into the clinician's hands. The patent was issued last November. Nevent is currently looking to engage a contract engineering and manufacturing firm to help move it through prototype and initial development, as well as a regulatory firm to help with FDA submission. Those will be the most immediate steps. I'm here at Bio trying to help sort of accelerate that. Bio has been fantastic. The Bullpen area has been probably my favorite part of the event. I've gotten to meet and speak with leaders of industry, including Boston Scientific, and as well as private venture capital, private equity. It just really opens up a lot of doors that could help me and Nevent accelerate this product development and really putting an end to a serious complication for our patients.